Breaking overnight, the CDC's new call to ban gatherings of more than 50 people nationwide as New York, Los Angeles, Boston, and Chicago all order bars and restaurants closed down. At least 64,000 schools also now closed across the country. 30 million kids told to stay home. Over the weekend, chaos at the airports as Americans race to get home from overseas, while President Trump urges cooperation and calm.
We will do whatever it takes.
Hospitals on the front lines of this fight, bracing for a possible spike that could overrun the healthcare system. The number of healthcare workers testing positive grows. Multiple workers in one Boston hospital coming down with the virus. An ER doctor in Seattle in critical condition, and medical staff pleading with the public to donate back those masks that are desperately needed.
Utah Jazz star Donovan Mitchell, one of the first pro athletes to test positive, joins us exclusively from isolation this morning with the latest on his condition and recovery as a third NBA player tests positive.
The simple steps we can take to help everyone around us stay healthy in this new normal of social distancing. The key to keep it away from others at stores and even on the street. The Surgeon General is here answering questions live.
And the signs of hope. From the cheers for healthcare workers in Spain to Italians singing from their windows. To the Broadway star encouraging students to share their sunshine songs. The incredible ways people are coming together in these extraordinary times. Our team covering all the angles on this global health emergency.
Live in Times Square, this is Good Morning America.
And we certainly do say good morning, America. Happy to be with you on this Monday morning. So much has changed in a short amount of time, but what has not changed is the American spirit. At home in Connecticut this weekend, neighbors helping neighbors, doing what we could to support local small businesses, staying within the guidelines of social distancing.
Yeah, it's been important, and even here in the city, you can tell it has slowed down.
Right.
People are listening to most people are listening about staying inside and doing the right thing. But you can tell Central Park is a lot more empty.
People keeping that respectful distance, as we are right here this morning. You know, the whole world is now in the grip of this virus. Overnight, every American Peace Corps volunteer has been ordered to come home, and Europe now the epicenter of this global pandemic.
And take a look at this extraordinary image from Vatican City, where Pope Francis gave his weekly Sunday blessing to an empty St. Peter's Square. Usually thousands of people are packed in that square to hear the Pope.
So we have a lot to get to, and here's what we know right now. Worldwide, there are more than 160,000 cases confirmed, and the global death toll now topping 6,000, as cases in the United States soar past 3,000. The CDC recommending all gatherings of 50 or more people be canceled for at least the next 8 weeks. New York City among the cities and states closing bars and restaurants to dine-in customers. New York City also closing its public school system, leaving more than 1 million students home this morning. Nationwide, 64,000 schools are closed. That's impacting more than 30 million students.
Closing those schools, a tough decision for New York's Governor Andrew Cuomo. We're going to talk to him about that, and also his call to bring in the military to help hospitals. The Surgeon General is also going to join us as we learn a new vaccine is being tested.
And we're going to begin this morning with Whit Johnson. He's outside of school here in New York City with more on the unprecedented closing. Good morning, Whit.
Michael, good morning to you. More than 1 million students in this school district alone will stay home today. The economy and the nation's largest city brought to its knees. New York's mayor says these closures are required to save lives and that he's responding with a wartime mentality.
This morning, extreme measures across the country to try to slow the pandemic. The CDC now recommending no gatherings of 50 or more people, as top health officials warn it could get worse before it gets better.
The worst is yet ahead for us.
President Trump urging calm, asking people not to hoard those household essentials while many store shelves across America are wiped clean.
There's no need for anybody in the country to hoard essential food supplies.
Nationwide, at least 64,000 schools are closed, impacting more than 30 million students. From Los Angeles to Milwaukee to New York City, the largest school district in the country.
It's going to be very difficult for a lot of families.
Mayor de Blasio saying schools will remain closed until at least April 20th. Officials now scrambling to provide much-needed meals for kids and a plan for remote learning.
There's no reason to put us in jeopardy. if we can easily have a good alternative at home.
And starting tomorrow, the mayor of New York City also ordering the closure of all bars and movie theaters, restaurants and cafes limited to takeout and delivery. More than 700 confirmed cases in New York State. Governor Cuomo asking private businesses to aggressively consider working from home or even close, calling on owners to voluntarily shut down their bar, restaurant, or gymnasium. Just outside of Manhattan in Teaneck, New Jersey, a new cluster of at least 18 confirmed cases. Officials encouraging all residents to self-quarantine. The entire state of Ohio closing bars and restaurants. Illinois also ordering restaurants to close, only allowing them to serve takeout. In California, the governor calling for similar shutdowns, including wineries, and urging home isolation for all adults over the age of 65.
We believe that it's appropriate under the circumstances to move in that direction.
And as spring break is set to kick off, Miami Beach and Fort Lauderdale announcing Sunday they are closing some beaches and enacting a 10 p.m. curfew. The mayor of Miami now quarantined in his home after being diagnosed with COVID-19.
I was very shocked initially, but then I realized quickly that I had to go public with the information because I come into contact with a lot of people.
At U.S. airports, chaos as Americans rush home following travel bans on European countries. People waiting shoulder to shoulder in long lines for medical screenings. Drive-through testing now increasing. Cars lining up in Wilmington, Delaware. And in that containment zone in hard-hit New Rochelle, New York, healthcare workers fully covered, reaching through a window and taking a swab.
Now, one very important note, despite all of the closures, the National Security Council is now saying that rumors of a nationwide quarantine are fake. And they're adding in a tweet that there is no national lockdown. The CDC has and will continue to post the latest guidance on COVID-19. Still, people are trying to figure out what these unprecedented changes will actually mean for their everyday lives. Robin?
Uncharted territory. Okay, Whit. The spread of the virus in the U.S. has been dramatic. Take a look. Just 2 weeks ago, there were 80 confirmed cases in 10 states, and now there are more than 3,700 cases in 49 states, all but West Virginia. Healthcare workers are now also starting to test positive. Eva Pilgrim is at Lenox Health Hospital here in the city. Good morning, Eva.
Good morning, Robin. Hospitals all across the country are battling this virus and preparing for it to get worse. Here in New York City, all hospitals will now be postponing those elective surgeries to preserve resources, beds, equipment, and staff as they get ready for the crush of patients that could potentially come in.
This morning, hospitals on the front line of the fight against coronavirus bracing for a possible spike that could overrun the healthcare system. In Boston, they're reassessing their supplies, gloves, masks, ventilators, preparing for the worst.
We're also setting up other testing sites, what's called alternative sites of care, to make sure that we can test patients and so that patients with mild illness don't come into the hospital.
As healthcare workers try to help the patients coming in, multiple workers at Brigham and Women's Hospital have now tested positive for COVID-19. The hospital contacting all patients and staff who may have been exposed. In Ohio, a nurses union is demanding more protective equipment to safeguard against infected patients.
We are very concerned that when this virus peaks, that we have enough of this equipment for our nurses to take care of our patients properly.
The number of healthcare workers testing positive for COVID-19 is growing. A National Institutes of Health employee, a healthcare worker in Newark, New Jersey.
This obviously becomes a risk when it happens more and more often because the supply of healthcare workers is, of course, affected. If you start quarantining more and more folks on the front line who see patients, that becomes a risk in and of itself.
And multiple caretakers in that nursing home in Washington. Now some are calling for more help from the U.S. military, asking the president to mobilize the Army Corps of Engineers to add medical facilities and ensure hospitals are able to care for the patients that may flood in.
I think making those preparations is a good idea now in case we might need them.
And now doctors are pleading with people, if you are one of those who are hoarding those N95 masks. They're asking that you donate them to a healthcare facility. There aren't enough of those masks, and they say they are critical to them being able to take care of people as this outbreak continues. George?
That is so important. Okay, Eva, thanks very much. Let's bring in New York Governor Andrew Cuomo now. Governor, thank you for joining us. I know it's been a trying time. Let's start with this hospital situation. You've warned that the hospitals in New York across the country could be overwhelmed and think it's time to call in the military?
Yes, good morning. Good to be with you, George. Look, we have been behind this disease from day one. We saw the disease developing in China back in November. We weren't ready for it, and we've been playing catch up ever since. You have to get ahead of this, right? It's not fighting the last war, it's fighting the next war. The next war is going to be overwhelming our hospital systems. You look at any of these projections and you see that coming. When you see that chart of the curve, I see it as a wave, and the wave is going to break on the hospital system. We don't have the capacity, a state, to build more hospitals quickly. The only way would be if the Army Corps of Engineers came in, worked with the states to retrofit existing buildings. Take my college dorms, take my surplus property and retrofit it for more hospital beds, because, George, that is going to be the need.
I know you've spoken to the president about this. Has he accepted your argument?
We've talked. I sent an open letter to him yesterday. I did talk to him about the testing, which was going very slow. And I said, let the federal government get out of the testing business and allow the states to take it over. He allowed us to take over the testing, and we've made great progress on the testing. But again, that was yesterday. Tomorrow is going to be the wave breaking on the hospitals. Now, just to give you an idea, state of New York, major healthcare system, I only have 50,000 hospital beds. I only have 3,000 intensive care unit beds. And these people are going to need the intensive care unit beds. The only hope we have now at this late date, retrofit existing facilities, get some of the people from the hospitals into those new medical facilities, and then backfill the hospital beds with the coronavirus. States can't build, George, as you know. Only the federal government can build. It's the Army Corps of Engineers. That's what they do. Let them come in today, because time is short. And this federal government has to get more engaged. There's been no country that has handled this that has not nationalized it. You just did a piece on all the different things different states are doing. This patchwork quilt of policies doesn't work. It makes no sense for me to do something in New York and New Jersey to do something else.
So is this new federal standard?
I close the bars, they go to New Jersey.
Right. Is this new federal standards enough that, basically no gatherings of 50 or more for 8 weeks?
George, no. You need the specific rules. Just take that litany that you went through. Every state cannot come up with its own rules. You'll just have people going from state to state. If I say you can't go to a bar in New York, you'll go to New Jersey, you'll go to Connecticut, you'll go wherever you can be served. That's the last thing we want. Set the national standards and let's live with them. Otherwise, again, you come up with this ad hoc system that's not going to work.
I know you were reluctant to close the schools, but especially because of concerns about child care and student meals. But the schools are closed right now. Have those issues been resolved?
Well, I closed the schools yesterday. New York City, Nassau, Suffolk, and Westchester, the main density of our cases. But I closed them with the condition that those local governments come up with a child care plan. Because again, if you follow the reasoning I laid out, your crisis is in the hospitals. That is what is going to happen. The crisis of hospital capacity. You close schools, nurses don't come to work, healthcare workers don't come to work. Now you have a real problem. So I have never had an issue with closing the schools. But I want to make sure, and I demanded, New York City, Westchester, Rockland, Nassau, Suffolk, well, I'm closing the schools. You must have that child care plan and a food program, because many students get their food, as you know, from the schools.
Yeah, it is so important. Okay, Governor, thank you for your time this morning.
Thanks, George.
Michael?
All right, George, thank you. And as hospitals brace here at home, some countries are taking more extreme measures overseas. Germany closing its borders to several countries, including France, Spain joining Italy, putting all 47 million citizens on lockdown for the next 2 weeks. Officials driving through towns using loudspeakers to tell people to stay inside, while Italy faces its toughest day yet, reporting 3,600 new cases and 368 deaths in 24 hours. But there are moments of hope, everybody. Take a look. In Spain, a social media campaign prompting families to come on their balconies at exactly 10 p.m. to cheer in support of the heroic healthcare workers on the front lines, and I'm sure that those workers appreciated the acknowledgement for all the important work that they're doing.
It was great to see that. There's huge economic impact as well, and overnight, the Fed took emergency action, slashing interest rates to near zero, along with other measures to keep the economy moving, but financial markets around the world still selling off. Rebecca Jarvis is on Wall Street with the latest. Good morning, Rebecca.
Good morning, George. That's right. The market this morning is poised to wipe out all of the gains from Friday, which was a record day for stocks. But today, things are looking like they could be down as much as 10%. That overnight action from the Fed, the emergency action cutting interest rates to near zero, was meant to help stabilize the markets. Instead, the markets continue to sell off with the realization that this new normal has a giant price tag. At this point in time, Mark Zandi of Moody's, the chief economist, estimates, George, it will eat into GDP by $120 billion. George?
Boy, that is a huge hit. Okay, Rebecca, thanks very much. Robert.
That really is, George. But now, let's put a smile on people's faces during this most difficult time. With school plays and events canceled nationwide, some stars are giving kids an audience on social media. Jennifer Gardner saying the show must go on, people, encouraging kids to share videos showing off their vast talents. And Broadway star Laura Benanti had the same idea. Take a look.
I know for me, my High School Musical was like a lifesaver. So if you would like to sing a song that you are not going to get to sing now and tag me, I want to see you.
So many beautiful voices, such talent all across the country. Kids sharing their videos. In our next hour, we're going to speak to Laura about what inspired her call out. Sometimes it's just those little things that can mean so much in a time like this. We'll have much more on the coronavirus emergency still ahead, including our exclusive interview with Donovan Mitchell, the NBA star who tested positive, speaking to us from isolation.
And the do's and don'ts of social distancing, how far you need to stay apart to keep you and those around you safe. The Surgeon General is going to join us live. Now let's go to Ginger.
Interstate 80 is closed again this morning. Just got note from the California Department of Transportation. They have had in some places, that was at Donner Summit where it's closed this morning. This is Truckee, 44 inches in 24 hours. Imagine that, 3.5 feet of snow. It's very helpful in a lot of parts of California to get this rain and snow. It gets that pack going, but it is not helpful on the roads. Also this morning, swift water rescue is happening as we speak in Dallas, so flash flooding there, severe storms possible tomorrow. Your local weather in 30 seconds. First, the Select Cities, sponsored by Sherwin-Williams.
Bring color to life with the very best paint, only at your Sherwin-Williams store.
Coat weather for the morning, warm jacket this afternoon. Today, temperatures are going to be topping out in the mid-50s. It is going to be the coolest out of the work week. So expect mostly cloudy sky this afternoon, but remaining dry. Could have a spotty shower early tomorrow, then a better chance of rain midweek. Wednesday into Thursday morning. By the way, as that rain moves out Thursday morning, look at this. Temperatures will be getting into the mid, maybe the upper 70s by the end of the work week on Friday. First day of spring. There it is Thursday, and a cooler weekend coming up.
What are you doing over there?
It's tough to quit smoking cold turkey, so Chantix can help you quit slow turkey. Along with support, Chantix is proven to help you quit. With Chantix, you can keep smoking at first and ease into quitting. So when the day arrives,